subsequent slide. So welcome everybody. I am Adam Pertman. Daniel Stein has fled the country. He is on vacation in Mexico, and we all wish him a very well-deserved holiday. I'm filling in for him today. I am the Communications and Coordination Director of NIC, and I also work with Stewards of Change more broadly on a lot of projects with Daniel, Sandis, and other people on this call, other of our team members. So welcome to the call. This is the second part of a deeper dive into Project Unify, which I assume or think most of you know about. If you don't, Dave Walsh, who is leading the project, co-leading the project, will be speaking in just a few minutes, and he'll fill us all in and bring us up to speed. Last week's call was I can't say it was general because we got pretty deep into the conversation, and it was a really, really good one. But today we will dive even deeper and start talking about some of the nitty-gritty of the work that we are doing, that we're undertaking. So we always start with a little housekeeping. If we could show it on the screen, Michael. Our friend Michael and colleague Michael, there you go. So please do keep your microphone muted. You can use the computer or your phone. You had both abilities. If your phone number appears when you look at the participants, if you see a phone number instead of your name, please, you can hover your cursor over the phone number and it'll give you the opportunity to change it to your name, which is obviously preferable. So if you could do that, that would be great. If you show yourself if you put your camera on, that would be great. I think Daniel says you get extra points or something, but I'm not sure where they're going. But you don't have to use your camera if you don't, obviously, if you don't want. We invite you throughout the presentation to join in. For those of you who have not been part of this series of webinars, which have been going on a long time now, we really encourage participation. We want comments. We don't want to, have serial presentations and then people speaking up with a couple questions at the end. This is a conversation. This is a discussion, and you can join it by putting a comment or question in the chat panel. You can there's a little raise your hand function, and it's really okay to break into the conversation. Don't be rude, but look for a good time and jump in. We would prefer that to almost any alternative. And you can mute or unmute your phone line if that's what you're on. You'll see the mute on your screen if you're on via Zoom, and on the phone line it's *6 to mute and unmute. You heard that the call is being recorded so that anybody can come back and see what they missed and hear it again, or tell your friends and colleagues if there's something that you want them to hear. And finally, for the moment, we do encourage anybody who has not yet joined the NIC Hub, please do it. You'll get notifications, you'll find out about these meetings, and you'll be able to participate at a different level than if you're just sort of popping in on Fridays. Next slide, please. I'm going to try to run through all of these pretty quickly because we have you will see just from this agenda that it is chock full, lots of presenters and presentations, and lots of slides. So I'm going to guess the presenters are going to go through them pretty fast. We always start, I'm going to run through this agenda first, and then we're going to pop back to number 1 on this list. We always start by introducing new people. So if you are new to these calls or haven't introduced yourself before, please, in the chat box, just write your name. And then one by one, I will call out your name, and please just give us 2 sentences about who you are and what you do and why you're here. So please do that if you are new to the call or have not maybe been on it for a long time. I'm going to tell you a little about NIC. You will see in the next set of Project Unified Team presentations. I'm not going to read all these to you. I don't need to. Who is presenting each piece of today's presentations, and you see, excuse me, and you see what the subject of the presentations will be. We'll get to next week much later in the hour or the next hour. Next. Actually, before we do that, so let's not do that. Let's go into the chat and see who we have that's new on the call. Please, if you are new, type your name in. Okay, I think we have Catherine Schulten. Catherine, would you say hi?
Hi, can you hear me?
Yep.
Great. Catherine Schulten. I'm very new to the call. Rita invited me just a few minutes ago, actually. But I've been working in identity, patient identity for many years, and I work for a company called All Clear ID, and we do a authentication.
Great. Ben Hogan.
Hey guys, Ben Hogan. I'm with a company called Sensing, and we're part of the projects that are being discussed today, doing entity resolution, so entity matching. We're a spin out from IBM, built a platform that we think is the best on the planet for putting disparate records from disparate systems together and matching them, and then also showing the relationships between the patients and the providers and companies and all those things. So glad to be
Great. Here. Welcome. Peter Adamowski. Peter, hello. Unmute.
You should be open, Adam. I'm unmuting people as we speak.
All right, Peter, while you unmute yourself, I'm gonna call on Diane Stevens.
Hi, can you all hear me?
Yep.
I am with the National Institute of Standards and Technology, and I work in biometric standards coordination. And I'm intrigued about joining this this group and this effort and what you're all looking to do based on some of the upcoming work that we're doing with NSPM 7 and NSPM 9. Thank you.
Cool. Glad to have you here. Peter, are you unmuted? Okay, keep working on it. Andrea Richardson.
Hi, I'm Andrea Richardson. I'm the CIO for the Rochester Rio, which is a health information exchange in upstate New York.
Great. Samantha Haley. Samantha, Peter, Samantha. Peter and Samantha, if and when you do unmute or figure this out, the problem, please just jump in, okay? I'm not going to keep coming back and bugging you. Where am I? I am on Mary Beth Carrillo.
Hi, can you hear me?
Yep.
Great. So my name is Mary Beth. I'm with the American Immunization Registry Association. Our registry systems, or IIS, do a lot of matching on the fly, and we're looking at how we measure how well our systems are matching and doing identity resolution. So looking forward to what I can learn from others on this call.
Wonderful. Michelle Zankin.
Hi, I'm with Zane Networks. I'm new to the call. I have just been sent this call by one of the groups we're working with. Currently, we're trying to develop an open source case management tool in the district, and I'm jumping on just to see what I can learn from you experts.
Great. Emily Weigand, I hope I pronounced that right. Oh, with Chapin Hall.
It's Wiegand. Yes.
Wiegand, sorry.
That's okay. Emily Wiegand with Chapin Hall. We do a lot of work with the human services particularly, and with entity resolution. So a colleague sent me this, and I'm curious to hear.
Great. And here's my next test. Nandini Mamburi.
Hi, can you hear me? Yep, you're close.
Yeah, we can. And you can pronounce your name correctly too.
It's Nandini Namburi.
Great.
Hi, I'm new to the call. I just got this invite from my manager this morning, and I'm joining from state of Minnesota. I work as a technical architect on some of the Department of Human Services applications.
Steve Ruth and John DeStefano. They look like they're a duo. Steve and John, are you there? Okay. What I'll do is at the very end, after I finish all these, anybody who's not been called on, if you can speak up, then just jump in. I'll let anybody, and anybody who hasn't spoken can speak up. James Johnson, Jr. We seem to be having muting issues.
Mic is open.
No?
Oh.
Hello?
The next two say no microphone in the chat.
Oh,
I'm not sure.
Your mic's open, James. I think.
James, you want to give it a shot? Okay, let's keep going. Melissa Keeley. The problems are growing here.
Hold on. Sorry, hold on, Adam. Her mic is not open. I got it now. Okay.
So who do we have? Let's try Melissa. Melissa Keeley? Nope. All right. Forrest White?
Forrest, I'm having...
Hello, I think I unmuted myself. I'm with the Altarm Institute in Ann Arbor, Michigan. We specialize in HL7, CCDA, V2, FIRE, IG implementations, reference implementations. So we're following several HL7 projects, ELTSS, Gravity, Passio, and VSER in particular. So thanks.
All right, and that's I think I've through the list of new folks. Is there anyone who is now unmuted or just came online who wants to identify themselves? Jump in.
Can you hear me?
Ooh, we have two. Okay, female person first, and then the male person.
Okay, Samantha Haley, Department of Vermont Health Access. I'm the business process manager, and we're particularly interested in person matching without using social security numbers.
Great. All right, and who is
next?
Hi,
can you hear us now? This is Steve Ruth and John DeStefano.
Great.
Yes. From SNC Partners in Connecticut. Been on a couple of the calls before, working on a bunch of interoperability projects in health plans and providers.
Terrific. Anybody else who hasn't spoken up?
Yeah, hey everybody. This is Peter Adamowski. I'm the Assistant Director for the North Carolina Health Information Exchange Authority, and working on a lot of interoperability projects, and very interested in patient matching.
Terrific. Going once. Anybody else?
Can you hear me?
Okay. Did someone speak up?
Everybody. Hi, everybody. Can you hear me?
Yes, Stephen,
yep.
hear you.
Oh, great. This is Steve Hernandez. I'm the Executive Director of the Legislature of Connecticut's Commission on Women, Children, and Seniors, Equity, and Opportunity. I'm interested on interoperability on the policy side, so I'm really excited to allow all of you to get a little wonky so I can learn a lot.
This is Atul Verma representing New Jersey Health Information Network and New Jersey Innovation Institute. Again, working on a lot of interoperability projects, and patient matching is always good to know about.
Okay. Is that everyone? Going once. All right, terrific. So great to have so many new folks. We seem to be attracting them like flies every week. It's quite wonderful. So again, I'm going to try to go through this very quickly. For new folks who don't know, the National Interoperability Collaborative, which is a program, a project of Stewards of Change Institute. There's a brief description on your screen, the community networks, which you can hear just on this phone, is diverse. It goes across the country and covers many, many domains, which was the whole idea. If you look at the quote at the bottom of the screen, it is an idea's time has come. And David our project manager at Kresge Foundation, whose funding enabled this work, you know, he said, he used that quote at the beginning, you know, near when we were just starting. It's an idea's time has come. I think we can all agree, and we're delighted that it's an idea that is actually being actualized. We're delighted by it. If you're new to us, please take a look at the website. I won't go into it right now, but please do. And this is the most active part of the work that we're doing. Next slide, please. And Project Unify, in particular, it's a proof of concept project that Dave, our next presenter, will describe to you all briefly and then go into today's presentation. And Project Unify is really our most significant on the ground, let's get started and do something that, you know, instigates real change in the world. And that's what we're all trying to do together, ergo Project Unify. Next slide. And the project itself is on our website and on the NIC Collaboration Hub. These are today's, well, these aren't today's speakers. These are actually members of our basketball team. No, these are today's speakers. Their bios will appear right before they speak, each one. Again, I'm not going to read them to you, but they're available to you, and the slides obviously are available to everyone. Let's go on. And I think with, am I missing anything? I don't think I am. Okay, great. Let's go to the next slide and get Dave started. Dave Walsh is the chair of the Might Attack Group, which he's led for lots of years, and now we're proud to have him with us as head of our proof of concept project, Project Unify. And I will, I think, without any further ado, hand the mic over to you, Dave.
Thanks, Adam. Before I really get started, I'm going to try and be brief here. There's lots of slides to come, and one of the things that I'd like to do is just kind of give an overview of what I have seen since we started down this path. I want to send a shout out to everybody who has been participating, because this project is really growing and changing and morphing as we look at different perspectives on it. You know, we kind of started out looking at some fairly simple, how do you connect healthcare and human services? How do you use common APIs to be able to do that? And one of the first dilemmas that we saw was this person matching piece. So we kind of started another group to be able to talk about person matching. One of the things most recently that I'm seeing is working with folks like the Interoperability Institute and their capabilities, which fundamentally they host APIs to be able to access FHIR resources up there, and that's the first step that they're taking. And we're also working with HS Link, who is more focused on human services. So the Unify is about bringing together health and human services to take a more holistic approach on the individual. Now, one of the things that I've been noticing lately is I've had some really good discussions with a group that is a participant in here called the EP3 Foundation, and some capabilities that they have. Marcelie has been leading that. What I have recently come to realize is maybe we're looking at things a little too simplistically. And by that, I mean having an application that can call a FHIR endpoint or eventually call a NEAM endpoint to be able to get to information. As we look at things like security, which Craig is going to talk about, previously I had looked at the security as fundamentally smart on FHIR, which is the way that FHIR does security, authentication, and authorization. But Craig really brought out a new area, and that is how are we securing the enterprise? And he's going to talk about that a little bit. But one of the things that this has caused me to do is say, there's more pieces to this than simply a FHIR API. And one of the areas that I intend to investigate is some technology called API gateways. And we'll bring that up in a little while, but it's fundamentally an ability for an application to call a gateway, and the gateway will do some level of determination of authentication, authorization, and passing that message to the appropriate individual. So as this grows in complexity, I think we need to at least consider other approaches rather than a very simple point-to-point, here's how security is handled on that. I did have the, first on this call today, I had the ability to see Ben Hogan, and Ben has been very instrumental in the sensing identity solution. One of the things that we're going to be doing with Ben is implementing a proof of concept to show how the sensing technology can accomplish this. So my point is we're expanding, we're taking into consideration more aspects of what we need to address. So Michael, if you could go to the next slide. About two and a half weeks ago, Dr. Rucker spoke, Dr. Rucker being the National Coordinator for Healthcare, spoke at a conference, the ONC annual meeting, and he spoke about an app economy. That was one of the things that he talked about. How do we make it easy, or how do we make it so that innovative developers can develop applications and not have to rework everything that we've done in terms of security, in terms of mapping and all of those things. So his goal is, how do we unleash the ability for creative app developers to bring value to the party and not worry about the technical details as much, focus more on the value proposition. So one of the things that we're doing with Project Unify, and specifically Project Unify UX, which is an app development framework that allows you to build upon the standards and bring that value proposition forward. We have gotten it to the point where it can actually run a simple application where it can, you can go to the next one, Michael, where it can run a simple application on either an iPhone or an Android phone or a web browser or a desktop. So one development platform, if you will, that allows you to write a solution once, not worry too much about the technical details, and the end result application will run on all of those platforms. Because the last thing that we want, and what often happens today, is developers have to develop for iPhones, iPads, and then they have to have another development team that develops for Android, and then another one for the browser. So what we're trying to do is bring those together as well. And we've got, our intent is to have all of this be open source software. And Andrew Lang, who until recently was from the state of Vermont, is has already established a GitHub repository for the code. So we're putting it out there, and we're putting it out there in a Apache 2 license, a very liberal license. So if anybody on the call said, hey, this is a good idea, but I should take that and change it around and make it my own, you're welcome to do that. So we're not trying to create in any way a closed source or proprietary. Andrew is helping us get that out there and is very active with the group as well. An example of what we intend to do is develop NEAM APIs so that for developers, NEAM looks very similar to what is happening in the fire space. NEAM is a data model and doesn't talk about how the data gets from point A to point B. So if we really want to have true interoperability, we need to focus on how we move that NEAM information around and how do we make it similar for a developer to be able to handle NEAM information as it is for fire-based information. Go ahead to the next slide, Michael. What we are focused on right now is more interactions with interoperability, the Interoperability Institute and Interoperability Land, growing those capabilities there. We already have a proof of concept working where we can communicate with Interoperability Land, and then how do we perform those same operations using HS Link to be able to interact with the human services information. There's other things that we need to consider. We're just getting started on is things like a test harness. If you write something, is there an environment that you can test it with? And right now, Interoperability Land affords you that capability. There's personas up there and so forth, which Mary will talk about. But we want to broaden that a little bit so you can test both healthcare and human services data as you go forward. Go ahead to the, well, let me just talk to the bottom point there. At the State HIT Connect conference in late April in Baltimore, we intend to be showing applications that are talking to a variety of fire accelerators, the Da Vinci Project, Gravity, the Cairn Alliance, and so forth, and also talking with HS Link for human services. So trying to bring it all together, which is what the Project Unify is all about. Go ahead, Michael. So I'm going to turn it over now to, who is next? Pradeep?
Pradeep. Pradeep is going to take the floor.
Good.
Before, just real quick, Pradeep, before we get started with you, just so we don't get too far, is there does anybody have any questions, comments regarding the project or anything that Dave just presented on? Because this would be a good time, because we're going to go to a lot of people and content before you get another chance to jump back at him. Anybody for Dave? I'll take that as a resounding no. Perfection, Dave. Thank you.
Thank you.
Pradeep, you want to take it?
Sure, absolutely. Thank you, Dave, for a great introduction and also for setting the context. And also talking about health and the connection with the human services aspect of this project. Happy Friday, everyone. I'm Pradeep Padilla. I'm a CDC Public Health Informatics Fellow at Denver Health, and I will set the context for the use case for this project. If we could go to the next slide, please. Sure. I would like to set the context by going over the definition of ecosystem. Since we are talking about health and human services, ecosystem is all of the living and non-living parts of the environment and their interconnections and their complex interconnections, which play a vital role in the well-being of an individual. Next slide, please. as highlighted in this infographic on the screen, so what exactly goes into the health? Because healthcare is only 20%, whereas the rest of the 80% is a combination of socioeconomic factors, physical environment, and health behaviors, which play an important role and where our data will be collected as well as the data is siloed. So this helps us in setting up the use case for this project. And again, this is an example use case that we have drafted. And if there are any feedback and suggestions, we would greatly appreciate that. Next slide, please. So for the use case, we have selected a hypothetical person by name John Smith Jones and his family. The slide is crowded, but I will walk you through that. So John Smith Jones works at a warehouse, and he was injured during his work. And due to the injury that was caused at the warehouse, he got hooked onto opioids. And because of the opioids or substance abuse issue, he had an issue. He was involved in an automobile accident and rushed to the hospital by an ambulance. And John lives close to the poverty line and has no insurance. So he's a frequent utilizer of the emergency department. And at the same time, because of the opioids issue, he may not be able to take the well-being of his child, John, who is 10-year-old. And John has severe asthma, and because of the exacerbation due to asthma, John is also a frequent visitor of emergency department and also a utilizer of the healthcare system. So because of the accident, John is charged in the court because of the driving under the influence and the reckless endangerment. And this has put pressure on the family. And John's son is now placed in the foster home, and he has to change schools as well. So next slide, please. So, and at the same time, as we have mentioned that John is living close to the poverty line, John is also significantly affected by many other social determinants of health. So, for example, whether John will be able to keep his car to get to the rehab or his job, and whether he will have access to public transportation will have a huge impact on how he is able to take care of his child and if he would be able to retain the custody of his child. So next slide, please. So as you have seen in this example use case scenario, I would like to take us back to the definition of social determinants of health as stated by the World Health Organization. So social determinants of health are defined as the conditions in which people work, live, age, and also set the forces and systems shaping the conditions of daily life. And as you can see here, this particular use case touches upon different aspects for John and his family. And they have a huge impact on the health outcomes as well, like mortality, morbidity, the expectancy of life, healthcare expenditures, health status, the functional limitations, and most importantly, as we are talking here, which is repeat utilization of the emergency department, leading to unplanned hospital readmissions. Next slide, please. Now, I would like to sum it up by bringing back to the use case and looking at different domains. As we were talking through this use case, we have touched upon many different domains. For example, we talked about employment, where John has his employee records. And because of the opioids issue, he's dealing with health domain and connected by substance abuse records. And with the frequent utilization of emergency department and ambulatory encounters, there are health records and rehab services for the opioids issue. At the same time, dealing with the child protective services or the foster care services for his child, 10-year-old kid, and arrest records and incident reports dealing with the Department of Justice, and school records because of frequent changing of the schools of his kid, which is the Department of Education. And finally, the most important aspect, which is social determinants of health, touching upon food insecurity, housing, and transportation. And in the context of the social determinants of health, I would like to bring upon saying that the food insecurity master list as a part of the Gravity project has been published, whereas some work is going on in the domains of housing and transportation. And does anyone have any insights about any work that is being done in the development of code sets for housing and transportation?
Hi, Pradeep. I have been speaking with the Gravity group about helping them with the code sets for housing. I do some work for HUD. I don't work for HUD, but I work on their data standards, the XML schema and such. And so I'm very familiar with some of the housing instability data standard values that HUD uses in their latest 2020 data standard. So that's one thing. I know there's a lot of other aspects to housing than just HMIS from HUD, but that's I hope to help a little bit with that process as they begin it.
Thank you very much. Could you please announce your name, please? I'm sorry, I could not.
I'm sorry, Pradeep. I'm Eric Yan, and I'm also the.
Thank you.
Yeah, just for everyone, I'm also the co-chair of this, and I work on HS-Link. The H is in. I'm sorry, HS, S is in Sam, and instead of a I, it's a Y in Link. So if you go to hslink.com.
Great.
Sorry, I was taking the call from the phone and didn't recognize the name. Sorry. Thank you.
So let me jump in just for a second to reinforce what just occurred. So if we really want people to jump in, so please feel free to do that, but do identify yourself at the start so that we know who's talking.
Hey, Pradeep, it's Forrest White from Altarm. How you doing? I was on a meeting yesterday with the Gravity Project. They had a community meeting, and they talked about starting the housing in March and start hitting that hard within a couple of months. And then after that is transportation, so a little bit later in the summer, I would anticipate. But that's kind of the sequence they're going in, so they're going to hit housing pretty hard here coming up in March.
Sure. Thank you. Thank you, Forrest. Thank you. Any other thoughts? Any other comments?
Let me, Pradeep, I just want to say, this was on an earlier slide, but you didn't accentuate it, so I will for just a moment, to say that it's stunning when you look at, that was a pretty simple use case, and probably not very uncommon. The number of domains and services that this one person and his son hit on is numerous, and I think it's fair to say that the common denominator is probably 0 to none of them talk to each other or exchange information that might be useful, that would be useful for dealing with the issues that this person encountered. So I think it's a real underscoring of just how far we have to go.
Absolutely, absolutely, because the information is siloed. The information, the way the information is captured is siloed, as well as because no one has a clear understanding as to how the other information system captures the information for an individual, even though we may be referring to the same person across different domains. Thank you for adding that.
All right, Pradeep, is that then for you for right now?
Yes. That's good.
Okay, next slide, please, and next presenter. Why do we have an appendix? Whose appendix is this? Who wants to own this slide?
Yeah, I added it, and maybe it wasn't moved to the end. Yeah.
Okay, so okay.
We can get past the appendix for the next speaker. Yeah. Yes. Okay. Yes. Thank you.
Okay, great. All right. I think, Brian, are you up? Brian, hello. Or Eric?
Eric, Mary, Brian.
Sure. This is Brian. Hi, Brian. Can you hear me okay?
We can.
Yeah. Oh, Brian.
Let's get back on track with the slides.
Which
please.
Brian?
I think Hans Picker. Back up, please. Oh, I see. I was
Eric, Mary,
on my screen. So Eric, do you want to start, please? And you have a team of people with you.
Okay. I'll just give. I ran through this a little bit last week, but HSLink is. I'm the CTO for HSLink, and it's a platform as a service for human services. It's open source. It's licensed under the Mozilla Public License v2. It's definitely an enterprise build out. It uses a lot of servers on Amazon and big data and Hadoop. So it's really not something that it's like some script you start up on a laptop easily. It's a lot of overhead. But we have our code listed on GitHub. If you search for HSLink on the web, you should be able to find all the resources related to it in the code. We've been, for this project, we're looking at using it to store and NEAM data structures. And NEAM can be represented as traditionally had been XML, and in the future, or currently you can also represent it as JSON linked data. And so to kind of standardize on the FHIR, the Fast Healthcare Interoperability Resource standards, we're hoping to use that JSON linked data representation of NEAM so that then you can, marshal that into something for FHIR. So HSLink could emulate the courts system storing NEAM courts information. It could emulate the county human services department managing the use cases case record for opioid addiction or child welfare data as well. So we might segment it into different account buckets to store the use case roles and departments. So HSLink could be segregated into multiple we call them project groups, but they're also kind of like customers as we host it for customers. But then within each customer account, there can be many, we call them projects and then sub-projects, and they can be grouped and mixed and matched, and sharing roles can be configured across those sub-projects. And so we're hoping it can fulfill the role of this project Unify by serving as this kind of human services, non-clinical server that can then transfer NEAM data structures to interoperability lands, clinical and public health servers for the purposes of transmitting social determinants of health information or two-way communication, maybe back from the clinical system back to the human services case management systems. So that's, I think, it in a nutshell. Adam, is that?
That's great, Eric. We are looking at your picture, which is great. But I don't know if you're looking at a screen, but do you have slides that you want to be showing?
No, I didn't have any such. I really wanted to. Yeah, I just wanted to play off of the presentation Craig has, and hopefully help Pradeep and kind of raise any questions or try to advance the conversation along further than we got last week.
Yep, and again, thank you for agreeing to co-lead this group. Mary, do you want to jump in with anything? I think you're our next slide. If you can move that ahead.
Certainly, I will be very brief. I know last week appreciated the opportunity to present on interoperability land and the work of the Interoperability Institute. Delighted to defer my time today to Craig Cabilio, who is the Chief Technology Officer at DCI and was one of the best CTOs that I worked with in my 12 years with the Department of Defense. And so delighted that Craig had the time today to share with us some of his technology and security expertise. If there are any questions or just a very brief refresher, Interoperability Land is a simulation environment of 12 fire servers that emulates a healthcare ecosystem and come preloaded with synthetic data. So really a safe testing sandbox where we can fail big, and we can learn. And very intrigued with Project Unify and enabling the interoperability with the HS Link. With that, I'll defer my time to the next speaker.
Great, thank you, Mary.
This is Brian Hansbecker. I'll also be brief. I'm with Iris Health Solutions. I'm the technical lead for the NEAM Health domain. The NEAM to Fire Data Interoperability Challenge is mapping between fire resources and NEAM elements. And you'd think that that would be easy, just duplicate the fire definitions in NEAM. But there are already over 300 healthcare-related elements defined over the years across NEAM core and at least 6 NEAM domains, including some of the domains important to the NIC, like human services and justice, possibly emergency management, immigration screening, etc. And unfortunately, few of these elements, previously defined NEAM elements, are aligned with healthcare information exchange standards, or for that matter, with each other. So clearly there's a need for healthcare data in these non-clinical NEAM domains. So one aspect of NEAM Health's mission is to harmonize these non-clinical element definitions by mapping healthcare standards to NEAM to enable that data interoperability between the clinical domains and non-clinical domains. And one example of this would be mapping fire resources to NEAM elements. And by the way, in closing, I've been using modeling and mapping tools developed at IRIS that include FireView, FimView, which is a federal health information model view, and NeamView, and a cool new integrated collaborative data modeling element called ISIP. And I yield to Craig.
Great. Thank you, Brian. Craig?
Hi, my name is Craig Cabilo. I'm with Development Consultants Incorporated. Thanks, Mary, for the introduction. And kudos to the Interoperability Institute for developing interoperability land to facilitate test-driven development. That's really the best way to take this approach. Mike, you may want to crack your knuckles because we're going to go through these slides really fast. Next slide, please. So, next slide. So we basically have
Craig,
the challenges.
You do realize that we have to 1:30. I just want to make sure that you are not envisioning that we only have to 1.
Oh, I actually was. So
good call.
Great.
Good call. Yeah. So don't altogether take your time, but we're in no rush.
Okay. So we're going to basically give a foundation of cybersecurity and especially in the context of access control, in order for us all to have a common vocabulary on how we discuss the proof of concept and interoperability land. And this is an extremely difficult subject because it's inherently complicated. You have multiple technologies within every system. They're developed in programming languages. You have operating systems, databases, authentication mechanisms, various network protocols, messaging services, cloud services, and all of those are an individual discipline that requires individual subject matter expertise. And then when you take those individual systems and you attempt to connect them together, it really exponentiates the complexity as well as some of the vulnerabilities and things like that. So the other thing is what makes matters much worse is every technology is constantly under threat pretty aggressively by people who are motivated by profit. So the threat landscape and the vulnerabilities are very dynamic. And I know this is dreadfully uninteresting to most people, which ultimately makes it a source of kind of fear that you're not understanding the context, a little uncertainty about whether or not you've implemented things correctly, and just doubt even about the subject matter experts. Next slide, please. There are a ton of cybersecurity standards out there, and the best available is from NIST. Diane, this may have interest you because almost all the majority of my slides are about NIST. In particular, NIST is codified by the federal, let's see, what is the exact name of this? The Federal Information Security Modernization Act. So that the federal government information systems have to follow the NIST guidelines. But it's not just for federal government. In fact, at our corporation, we adopted them quite early. The DoD has started to mandate that, though. For all defense contractors in 2018, you had to certify to a NIST standard, which is 800-171 for non-federal systems. There's a new cybersecurity maturity model that requires certification for all DoD subcontractors, and this is pervasive. These standards are universally applicable to IT systems, and the standards also map very nicely to the international standards. So we're certified in ISO 27001, but we did it based on our NIST 800 controls. So these things all work together very well. Next slide, please. The basis of the NIST cybersecurity framework, they have a cybersecurity framework, and then they have the RMF, which is the risk management framework. And really, cybersecurity is risk management. I'm not going to talk about all of this today, but I thought it was important just to give you a trail of breadcrumbs so that you could follow this along after the fact if you want to investigate any of these a little deeper. But what it really comes down to is you have to categorize your system based on the data within it. You select the controls, which are basically, typically the 853 controls, as well as things like HIPAA, PCI DSS, and any other standards. And then I'll talk about the implementation of those controls a little bit. And then this is an iterative cycle where you assess, authorize your system, and then monitor compliance. And like I said, this is a dynamic landscape, so this is constantly being done. Next slide, please. I also wanted to talk just briefly about categorization, because when most people think about cybersecurity, they only think about confidentiality. But really, cybersecurity includes both the integrity of the data and system, as well as its availability, because an information system is no good if the information is corrupt or if the system is unavailable. Next slide, please. So all of the controls we're about to look at really incorporate all three objectives of confidentiality, integrity, and availability into the controls. The NIST 853 is kind of the Bible of cybersecurity standards. This is the one I said maps really well to the international standards. Revision 4 is current, Revision 5 is in draft status right now. And these are the recommended security controls for federal information systems. But like I said, it's not just government anymore. I'm really going to focus just on access control, spend a little bit of time on identification and authentication, and a little time on security assessment and authorization, which deals with interoperability specifically. Next slide, please. So the security assessment and authorization family has 9 controls, and there's abundant enhancements that specifically address interconnected systems. Next slide, please. In particular, CA3 talks about what I consider to be the most complicated and potentially most important aspect of interconnected systems, and that is the interconnection agreement. Effectively, this control requires that not only do you formalize that through documentation, but you also define things like the interface characteristics, the specific security requirements of the interfaces between systems, and the nature of the information that's communicated. And it also mentions approved boundary protection, which I think Dave kind of talked about with the API gateway concept, that at the edge of interconnected systems, there are sophisticated mechanisms to provide boundary protection. Next slide, please. So in the systems and communication protection, I'm going to talk a little bit about that boundary protection. Next slide. Boundary protection gives you the ability to monitor and control communications, at the boundary or the edge of the system. And it's really sophisticated. You can actually, you can filter, assuming you can see inside the data, you can filter based on things like security attributes, which we'll talk about here in a minute. But you can basically ensure that between various agencies, you can't share information that's not approved, and you can have rules at the edge of boundaries that are, it's required to have this type of boundary protection to ensure that data does not traverse a boundary that's not authorized for that traversal. Next, please. And we're going to talk a little bit more about identification and authentication. I just wanted to put this slide in here because a lot of people misconstrue identification, which is basically the authentication process, from authorization, which is what that person is then allowed to, or authorization, which that person is allowed to do. So I'm not going to get in deeply into authentication, but identity federation is a common practice now where you can log in with your Google account to Facebook or something like that. So there are mechanisms to allow people to authenticate successfully. And the real goal of authentication, like I said, is just to uniquely identify that person, meaning that there's non-repudiation. That person cannot deny that they did what they did in the system. Next slide, please. So we're really going to focus today on access control, in particular, information flow enforcement in remote access and information sharing among systems. Next slide, please. So remote access is exactly what you think it is. It's allowing organizational information to be accessed through external networks, and this could be by users or potentially by processes acting on behalf of users. So this control basically doesn't specify the format of such authorization. It just ensures that you, again, document the restrictions, the configuration requirements, and any type of implementation guidance for external community or remote access. Next slide, please. And information flow enforcement. And again, there's a lot more depth to each one of these subjects, but I just kind of want to touch on them as we get further and further from the general to the more specific. So information flow regulates where information is allowed to go as opposed to who's allowed to access that information. So like I said, at the boundary of interconnected systems, you have the opportunity not just for policy enforcement, but also disallowing or restricting access to the flow of information. Next slide, please. And there's also a control that deals specifically with how information is restricted. So for example, privileged medical information or any other type of classified information can be restricted based on authorization of that between sharing partners. And so that's part of that interconnectivity agreement. And this is also one of the, like I said, interconnectivity agreements, or how you share information among interconnected systems, is probably one of the most complex aspects of sharing information among resources. It's, you have to really define down to the deepest level, the security attribute level, what information is allowed to traverse system boundaries. Next slide, please. So how do we do this? One of the easiest ways, and this way works really well for when you can classify users in various roles, is role-based access control. So for example, if you have administrators or even classes of people like doctors, patients, or any of the, think of the use case that was presented earlier by Pradeep. Role-based access means that doctors can only call APIs specifically designed for doctor-related functions. So that's one aspect of control. Next slide, please. But that's insufficient to allow patients or organizations to restrict the actual data. So this is where it gets a little complicated. But security attributes are metadata that are associated with active entities, which are subjects, and think of that as people or potentially devices acting on behalf of those people, and passive entities. So these are the objects that are associated with data structures, so like records, buffers, tables, files. If you think about, I have a security clearance that's secret, but I'm trying to access a top secret file, both of those, the secret security clearance and the top secret label on that file, are security attributes. Next slide, please. So here's a typical example of how a subject, a person, is trying to access a record, and the subject's attributes are brought into a access control mechanism, if you will, the gears in the center of the diagram. The access policy that you've defined is brought in the object's attributes. So again, that classified or top secret record, and then any environmental conditions. Is this person accessing over the right network? You may have time of day restrictions or things like that on when these records can be accessed. So all of these security attributes are considered by the access control mechanism on whether or not to grant the subject access to the object. Next slide, please. Now, I found this to be almost incomprehensible, even after looking at it many, many times. But what it goes to show you is there's not a single administration point in this model. And this is especially true of interconnected systems. So each information system is going to have local subject attribute repositories, potentially local object attribute repositories, as well as enterprise subject and object level attributes. So all of those form different administration points. You can see how this becomes extremely complicated. And then imagine that you have to map these attributes between multiple organizations. That's the level of complexity in what we're dealing with. Next slide, please. So, putting this all together, we have a user principal who authenticates with their hospital, pharmacy, court, whatever, Facebook, and that's their identity provider. The service provider, in our case, the system, the information system that we're dealing with, uses that federated identity management solution to get user data from each or any of those identity providers via standard protocol. So you've heard on previous discussions, we've talked about OpenID, OAuth, SAML. The service provider then receives some security attributes about the principal, or in this case, the subject, from the identity provider and potentially augments those from the local or enterprise attribute repositories that we've seen. The system then, through a series of trusted interconnection agreements, may authorize a user to access an external provider over a pre-authorized secure network connection that incorporates the boundary protection devices that we've seen earlier. The remote system then grants or restricts high-level programmatic access to those APIs based on the principal's role-based access control. So I'm a doctor, can I do doctor things? I'm a patient, can I do patient things? And then the system further restricts low-level data access based on the principal's attribute-based access controls. So effectively, does the principal have the ability to access the object? And typically this is done as you can have different policies in place that either exclude everything and then allow one grant to give access. There are a lot of different ways to do this, but effectively the one thing I wanted to get in here is the system has to write an audit record in a predetermined canonical format. So all these systems, interconnected systems, should agree on a standard format detailing why the principal was authorized to access the object. And that effectively walks you through a standard workflow for any one of the use case or any one of the entities that was defined in the use case. Next slide, please. So how does this work with healthcare data? I actually did all of the slides prior to this one without actually looking at what the HL7 or the FIRE group had done with respect to security. And I was very pleased to find out that they strongly support the need for written authorization procedures. And they have some proposals in place to develop these security labels and attribute-based controls. And there is a NIST standard or special publication, 800-162, that deals specifically with attribute-based access controls. So they do, like I said, strongly support this, and the approach is to increase trust among the TEFCA entities so that security labels on information can be shared with protections that are enforced within enterprises. And there's a little bit more. There's a link to these documents where I got this information. These are direct quotes off of the documents I found on this site. Next slide, please. I also found some of the definitions. So there's an HL7 V3 security policy that is light on, it's got a lot of substance, technical depth, but it's light on verbiage. So it doesn't really give a nice description of what you're viewing, so it's a little hard to understand. There's also the value sets for the role-based access control that are defined, and there's some interesting information out there on the download site too that I found. So I'm relatively new to this. I've been working in cybersecurity for decades, but as far as FIRE and HL7, I'm just being initiated. So a lot of this I found interesting, and I provided links to everything that I discovered. And I believe that may be my final slide. So I'll open this up for, yeah, so I'll open this up for discussion at this point.
Well, let me just, before I think several people have indicated that they want to jump in, but before they do, I just want to ask the group, excuse me, if anybody needs or wants any definitions. I mean, we've gone through a lot of technical jargon, not in a negative way here. I'm guessing not everybody is familiar with all of it. Are there any elements, definitions of anything that people would like to hear before we go into more discussion? Please feel free to speak up or put your name in the chat box or any way that you want to let us know, or just speak up. Anybody? Or comments on what you just heard? Any crickets?
So this is Mary Kratz. Thank you, Craig, for the presentation. Wow, a lot of depth and breadth there on security. I guess I put a couple questions in the chat box, and kind of the one that's burning for me is I know in healthcare, a lot of our electronic health record systems are role-based access control, where you'll put in a provider, a nurse, all the various healthcare roles for access. Very interesting that you highlight the recommendation for attribute-based control. Can you tell us a little bit about attribute-based control and how interoperability works between attribute-based and role-based controls?
Sure. So let me address your first question that you put in the chat first. And it has, I'll just read that for people who aren't looking at the chat, but it basically says, what are the pros and cons of the various identity providers? So OpenID is sufficient for IOL to HS Link, or would OAuth be better? And what about SAML? And ideally, I think when you're dealing with these systems, you're going to want to support as many identity providers as you possibly can. The identity provider is really just that non-repudiation step. I am who I say I am. And most of them support multi-factor authentication. So you may need to log in, if you're in the military, you log in with a CAC card. If you work for the federal government, you log in with a PIV card. But you basically need to support as many as you possibly can in an interconnected system like this. Because you're going to have people logging in from all over the place. From their doctor's offices, they may be using something like an Active Directory. I would say that if you can, you would support as many as possible, because that's not really where the meat of security is at. That's getting you through the door and uniquely identifying that I am who I say I am. It's the authorization that really is the tricky part, meaning, can I access this record? So I'm a patient, can I see my own record? I'm a doctor, an oncologist, can I see this person's record? I'm in this health network. I'm a social worker. Can I see, do I have access to this data? So effectively, I don't think role-based access control is sufficient in these systems, very much like it's insufficient in, let's say, the Federal Bureau of Investigations or the NSA, where you deal with classified data. Your classification level is too fine-grained just to say, well, this role can do these things. The role is still, I think, an essential part of security, because it limits what you have, the questions you're allowed to ask. But ultimately, so role-based access control limits your APIs, right? What you can do through an API. The answers, though, to the questions are really attribute-based. So I can ask, can I see this document? The answer on whether I can see it, though, depends on my security attributes as a subject and the object security attributes, and whether or not those two align. So the example I gave earlier is, I'm a FBI agent and I try and access a top secret document, right? If my security clearance is greater than top secret or top secret, I can access that document. Maybe. Right? There's also this whole least privilege need to know exclusion. So there are environmental factors that are shown in the diagram previously, where you consider not just the subject and the object's attributes, but you also include the environment. So I'm not working a case in which this object is really accessible to me. Even though I have the clearance, the object may not be in my purview. And so I would have to get additional access to see that document. Just like one doctor, so if you're seeing an oncologist, that doesn't mean every oncologist in the country has access to your medical records. And that's where the attribute-based access control comes in. And is, I think, necessary, not just a nice feature.
Dave, I think you messaged. Do you have something you want to speak up? Hello?
David, you're muted. My apologies. So I've had a chance to talk to Craig previously. I am not a cybersecurity guy at all. But what I have done is written an application, a FHIR-based application, that communicates with the Blue Button project out of CMS to be able to see claims data out of CMS. And the way that was handled was to use a standard called SMART on FHIR, which is basically a combination of OAuth 2 and OpenID Connect. So, you know, I look at a lot of what you said, Craig, and absolutely agree that that's necessary, and very necessary when you're looking at domains that hold the healthcare information. So the back room, if you will, to make sure the information is going out to the right person. What I'm interested in pursuing is the use case that we're looking at with where ONC wants to go and so forth. And that is fundamentally, I, as a patient or just as a citizen, should be able to pick up my smartphone and access my records wherever they're at. So it could be from my primary care guy, it could be from the hospital, it could be a mixture of those. And if we're going to ask people to present a username and password with each place they go to access data, that's going to be impractical. So something like Smart on Fire, I don't really think it's sufficient, where it's permitting access, example, me as a citizen, to any of my healthcare data wherever it exists, or to my psychiatrist who has access to my behavioral health data, but my podiatrist, for example, does not have access. So they may have roles on the back end. I'm interested to start engaging with you on how we control things, because I'm struggling to find a role-based approach to allowing access to my different data. And I guess the key is that nationwide, wherever this information is stored, needs to be the same. Otherwise, when I try and access it on my phone, I can get into this one, but I can't get into this one, and so forth, which kind of shoots a hole in everything. So I guess what I would ask is, with that deep knowledge that you've got of cybersecurity, which a lot of us don't, to help lead the discussion on how we implement those standards to smartphone apps and everything else, like Dr. Rucker is saying.
Well, I think that like Project Unify, let's say that's the service provider, right? Mm-hmm. So you log in once, or you authenticate through Google. You accept Google's OAuth SAML OpenID token to Project Unity. That uniquely identifies you as the person. Project Unity has some additional security attributes from their enterprise repository that they apply to you. And then Project Unify has relationships with other entities. So other organizations that may be doctors' offices, hospitals, things like that. So those trust relationships allow you to ask questions to those agencies. So you've established enterprise interconnectivity agreements and done all of the due diligence for the secure connection to those third parties. And then those third parties will grant access based on who's asking the question. So again, if I log in as a doctor and I'm asking to the service provider, and I ask the question, can I see this patient's records? There's going to be, you go out to a third party and you ask that question to them, and they provide an answer on whether or not you can see them. And I understand that's kind of a complicated approach, but I think it's the only way it works, is that you have to, so whoever is the service provider in this case, and it looks like HL7's done a lot of work on this, has to define a standard set of attributes and potentially a standard set of roles that will allow everybody to interoperate. And then the record format issue, there's a lot of services that can translate data on the fly. There are network appliances that do it. There are cloud services that allow you to take one mapping to another. So, like we've talked about NEAM and HL7 being in different, or in FHIR being in different formats. No. I'm not seeing that as really the fundamental blocker in this situation. I think the real complexity comes in when you try and interoperate with multiple agencies. You all have to be on a standard, authentication and authorization platform. And somebody needs to not just help develop those standards, but also has to be the service provider that's going to tie them all together.
Right.
Thanks. And I just wanted to say it's great to have you on board, somebody who really understands security, so that as we go down this path, you can help guide us. Thank you.
Yeah, I was just going to say the same thing. I'm looking at some of the comments, and there's some real good insights. Not too many, so we invite others to join in. But I think that this is just the level of participation we're looking for, not just on this call, but with the project itself. So this is out of order in the slides, but please sign up for the hub itself, so we know who you are, you know what we're up to, and sign up if you have interest or expertise. Please join us on the project itself, on the proof of concept. I mean, I hear right here the value of your input, and I'm sure Dave agrees, I'm sure Eric agrees, that hearing your voices and getting your knowledge will make a big difference in how this thing proceeds.
Yeah,
so sign up.
If we've got just a moment, Adam, I see that Alan Byers, a couple of years ago was the HHS entrepreneur in residence to CMS addressing many of these issues. So if we could at least take his comment. You want to say something about OpenID Connect?
Yeah, I just think there's a fundamental choice whether this sort of thing would be modeled in HL7's security, basically as a FHIR resource, or we leave that to sort of and use OpenID Connect and try to model those relationships as identity claims, kind of in an OpenID Connect style. So that's a fundamental architecture recommendation, is that we use identity standards to manage roles and not conflate that with healthcare. Keep FHIR for clinical information and health information. I have a URL where I've been trying to work on this and would love the help that I'll post. It's just a README in GitHub. Thank you.
Great, thank you. I'm going to call on, forgive me, we're going to need to wrap up in just a few minutes to be respectful of people's time. But Michelle, do you want to, you ask a good question. Would you mind reading it out loud to the group or asking, and then some real quick responses, and then we need to wrap up for the day.
Thank you. So this has all been very interesting. So I'm a nurse. My function with the company I work with is really healthcare domain expertise. So I go in and work with the developers to help them make it specific so that it fits clinicians' workflows. So a lot of this is way over my head, but listening, it sounds, I also work very closely with CRISP in the Maryland, DC, Virginia region. That's our HIE. And all of this, as you're talking about the authentication and how the providers and role-based access to patient information and how specific and important that security is, I feel like that's a lot of what we talk about on that HIE, I guess, arena. That's what we talk about all the time, is how do we make sure that the right, so with sensitive data in particular, for instance, substance use data. There's a lot of money in SARS grants right now that's trying to help. How can we share data with these vulnerable populations, minor reproductive data. So the security is constantly being talked about, and what I'm hearing on this call is very similar to what we're talking about with the HIE. So I guess my question is, am I understanding what you're saying?
And I think you are, and I agree that there are a lot of approaches. What Alan was saying makes perfect sense from a healthcare network provider. I think that they can provide a lot of that information, but I also think that if it's down to people's smartphones, down to that level, patient level, I'm not sure that all of the attributes can be represented in a claim for your average user. So there's just a ton of complexity here, and I think you perfectly understand the level of detail, because the record attributes and the person's attributes have to be right, and that mapping is really in my opinion, the most difficult part.
So I'm going to jump in because I'm watching the clock. Can we get the next slide, please? And we're going to start getting to a wrap on this for now. Rita, are you back up one, please? Just for a second. Thanks.
Yeah.
Rita, are you with us?
Yes, I am. Can you hear me?
Hey, could you just take a minute and talk about your end of this for next week, and then I'll give a little bit more of a preview, and we will wish everybody a good weekend.
Sure. Although I think there's just a little bit of a mix-up in terms of the actual date that appears at the bottom. So I'm Rita Schwartz today. And in addition to being a member of the Project Unify team here, I'm involved with ONC's FAST initiative. That's the Office of the National Coordinator Fire at Scale Task Force. Carmen Smiley, who's also online today, she is very involved with that effort, specifically with the Tiger team that is looking at the issues around identity and matching. And basically what FAST is a community of people that ONC has brought together to identify and address barriers for data exchange between healthcare entities like providers and payers using FHIR. And so they've stood up several different work groups and focus on things like security and identity, which is the piece that's addressing the matching. And I'm sure Carmen can chime in if there's time. Basically, they've identified some barriers and solutions that are informed by many different industry efforts that could also inform some of the things that are discussed on these calls, and the proof of concept being developed underway. And so hopefully we'll be able to hear from them soon. Date still TBD, so thanks.
Yeah, okay, great. And I'll wrap it up by saying that next week, Daniel will still be away, so you'll see my face and hear my voice leading this charge. Next week, you'll be hearing from Ryan Howes, who is with Levitt Partners. What we've tried to do with Nick, and I think the people who are on this call who have long been with us and who just came on, see just the diversity of voices and people that we're bringing together. One of the goals that we've had on these calls is to expose people across sectors to the various initiatives and projects that are going on, Da Vinci and all of the others that you've heard here and others. And next week is going to be yet another in that series, so that people are exposed to the nature of the work that is interoperability work that is happening across the country. Ryan is, as you see on the slide, manages the Cairn Alliance, which is yet another of these initiatives. And I think it's going to be a terrific conversation, We've had some pre-work on this. And we invite all of you to join us yet again. If you have any questions, email us. Please do sign up for the hub, and if you're interested in either joining or just monitoring our proof of concept, join up with Project Unify. And we thank you for being with us today, and wish you all a very good weekend.
Thanks, Adam.
Thank you.
Thank you, everyone.
Okay, bye-bye, everybody.
Thank you.
Bye.